Assalamu alaikum. Hello, welcome to Care Across Cultures. I'm your host, Mirban Hussain. Today we're exploring an innovative approach to healthcare education. I'm joined by Jayne Lowe, who's the Clinical Director at Rotherham Hospice, and Annie Mae Morris, who has made history as the first higher education apprentice at Rotherham Hospice. I'll be introducing you to my guests in a moment. We'll be talking about this groundbreaking initiative which supports Rotherham Hospice's Living Life's Wishes strategy and what it means for the future of palliative care in education. Before we go there, as always, the views and opinions expressed on this programme belong to me and my guests and are not necessarily of Link FM or of the organisations that we represent. If you'd like to join the conversation, please call us on our studio hotline 0114 261 8181, or you can send us a text message on WhatsApp 07939 849 339. Love to hear from you. Any views, any opinions, any questions that you have. I hope everybody's had a wonderful weekend and a wonderful week from last week. I've been busy in a wedding, my nephew's wedding, which most people will know who are listening that Pakistani weddings are crazy. 2 weeks of non-stop. I actually danced, and I don't even dance, so I don't know what happened there. Anyway, I'm going to go and introduce my guest now. So I'm going to start with Annie Mae. Annie Mae, what do you prefer? Do you prefer Annie or Annie Mae or what?
Whichever. I like Annie, but Annie Mae works.
Annie Mae works, okay. I love Annie Mae. I think, that double barrel thing, it's really great. Welcome to the programme.
Thank you.
How are you feeling?
I'm good, yeah, I'm really excited.
You're really excited?
I am, yeah.
Oh, that's really great. Have you travelled far today?
Not very far now, just from Barnsley.
Just from Barnsley?
Yeah.
Well, you're most welcome.
Thank you.
And Jayne Lowe. Hi, Jayne.
Hi.
How are you?
I'm good, thank you.
If you remember, you were on the first inaugural programme.
I was, yes.
Yeah. And we couldn't get into the door, could we?
We couldn't, no.
It was terrible. Anyway, welcome both of you.
Thank you.
Thank you for joining us.
No problem.
And I'm going to start some questions now. Okay. So, Jayne, can you start off by telling our listeners a little bit about what Rotherham Hospice is?
Yeah.
And a little bit about what your role is.
Yeah, so Rotherham Hospice is a 14-bedded unit, inpatient unit, where we look after patients who are either coming in for symptom control or end-of-life care. We deliver the same care in the community that we do in the inpatient unit, so patients that choose to die at home will deliver the same care in their own home. We'll go in and relieve patients' symptoms, support the families. They don't have 24-hour care in the community as they do in the hospice, but other than that we provide the same level of care. We also have in the clinical services we have counsellors, patient and family experience team, physio, OT, complementary therapists, so patients and relatives can have complementary therapy as and when.
So that's great, isn't it? Because it's not just about the patient.
No.
It's also the family members as well. They can access some of these, or most of these services as well, can't they?
Yeah.
Which is amazing, thank you. And your role as a clinical director,
Yes.
what does that actually entail for our listeners so that they can get an understanding?
So I am the Director of Clinical Services and the Registered Manager for the hospice. I oversee all clinical services. and directly line manage the heads of service for each of the areas. So I'm involved in everything to do with clinical services.
Which is amazing. You do a wonderful job. Thank you so much. Annie, okay.
Yeah.
Before we dive into your experience, can you briefly share with us what drew you to this unique opportunity?
Yeah, so I've always been interested in science. Just from being really young, I've been good at it, and I'm also I'm not interested in working in a lab specifically, but I want to work with people. So I've always wanted to work in healthcare, and I love the idea of being responsible for patients, and I think it's really rewarding that they put their trust in you, and you can just give them a better quality, maybe quantity of life.
Oh wow,
It's really
I
rewarding,
love
so,
that. I
yeah.
love that, working with people and a better quality of life.
Yeah, so it
But,
was
yeah.
it was a really good opportunity at Rotherham Hospice to get some experience.
How does it feel like being the first?
Yeah, very special.
Very special.
Yeah.
You are very special. Thank you for that. So, Jayne, let's talk about this higher education apprenticeship programme. What inspired this?
So even when I did my own nursing training years ago, it was always that if you didn't have the experience, you couldn't go on to the university course. And things sort of, I don't feel like we've ever changed, because we have people like Annie that's at sixth form that's ready to apply for medicine, but nobody would give her an opportunity to do the work experience. So I sort of met up with our volunteer manager and our learning and development manager, and we come up with this and said, this could work. This could work for the future of the Y13s in sixth forms and colleges. So we thought we'd try it, and Annie was very kind and let us use her as the first one.
You're very welcome.
So how long is this programme?
So Annie's done 12 weeks, but we can make that shorter or longer. I suppose we're hoping for the feedback from Annie after this to say what went well, what didn't go so well, what would be better in the future.
So still flexible at the moment. Fantastic.
Absolutely.
I like that it's not set in stone, because sometimes these things, when they are set in stone, there's no sort of real room for improvement. Thank you for that. So, Annie, when you first heard about this opportunity, and what were your initial thoughts about being a pioneer in this field, being the first?
Yeah, no, I was really excited. Like I say, it's like you need experience to go to uni and apply to medicine, but not a lot of places offer it, so it's really difficult. So as soon as I heard about it, I knew that I had to do it.
So you said that you're actually applying for medicine.
Yeah.
So you want to be a doctor. Okay. Any particular field?
I'm not too sure yet. So I've worked with a lot of different people at Rotherham Hospice, and I am really interested now in going into palliative care, because I think it's really important, and it's something which I didn't think about before. But I think it's really important to care for people at the end of their lives.
And I think that's one of the reasons that, Jayne, you've sort of looked at this, haven't you? Because it's about opening a perspective of people, especially young students who are sort of, they're at that really difficult period in life, aren't they, where they've got an idea of what they want to do, but they're not really sure. And this experience, helps to focus that, doesn't it? Yeah, fantastic. Thank you so much for that. So, Jayne, what were the sort of main challenges, concerns you were faced with when developing this idea, or were there any?
I think you've always got to look at, obviously, Annie's not 18 yet, so we had to do things a little bit differently. So lots of the things that Annie's been doing has been more her observing rather than taking part. We wanted to make sure that she was able to see all parts of the hospice as well, so she's worked with everybody. I suppose one of the challenges were getting everybody at the same time to say, right, this Tuesday can you have Annie, and them not be busy, but we've managed to work around that. We've had to change a couple of things around, but we've worked around that, haven't we?
So how easy or difficult was it in terms of Annie being under 18? Because there are policies and procedures that we all have as it's Rotherham Hospice is an adult hospice, but not just that, but you know there are lots of.
So Annie's coming on the volunteer programme. So she's coming as a volunteer. She's not an actual apprentice. She's a volunteer. So it's sort of work experience. So she's coming through Gracie and her team.
It's a bit like the old Trident work experience that they used to do at schools many years ago. I'm showing my age now.
I don't think me and Annie know what that
No,
is.
no, I'm showing my age now, which is fine. But that was a very similar thing it was about gaining experience, and it was national, you know. So they had this. It was called Trident, and it was work experience, where 16-year-olds went, you know, into various sort of sectors, and had sort of work experience for, I think it was about a month or 2 months or something like that, which is really good. So, Annie, were you nervous about being the first?
Not really. I think because obviously everyone at Rotherham Hospice, it was clear to me before what I would be doing, everyone that I'd be seeing, and everyone was really nice and supportive, so I didn't feel nervous or worried at all.
So what did any of your friends and colleagues at school say? What have they said about this?
I think there's like a big misconception around hospices, because any time I say, oh, I'm doing it at Rotherham Hospice, a lot of people go, oh, I couldn't do that, oh, I couldn't do that, it's too sad. But it's obviously it's sad, but it's really important, and it's not a sad place like you think it is. With the support which people are getting, it's actually quite happy to see that people get such good support at end of life.
Right, okay. So you're not only just getting some experience for yourself, you're also sharing a wider vision of what hospice is, that it's not a sad place, it's a place of life and happiness and living as well.
Exactly.
So you're also an ambassador now for Rotherham Hospice, aren't you? In terms of sharing what it is that, you know, that sort of positive aspect of hospice care.
Yeah, definitely.
Well, that's great, thank you. So, Jayne, I'm going to come to you specifically around our Rotherham Hospice Living Life's Wisher strategy. And this sort of programme that Annie's on, how does that sort of support the Living Life's Wisher strategy?
So, as Annie's just described, she's going away and shouting to other people that actually it isn't a sad place, it's quite a happy place. And in having people like Annie come to us, they can share that message out to everyone else. Yeah. And hopefully Annie will share that, and we'll get more people from her school.
Definitely.
So, and I was going to ask, in terms of, this is not a one-off.
No.
Okay. So you've got plans for this. So help our listeners understand that. What are we looking at in terms of how often will this be done a year? Is it once a year, twice a year? Is it a rolling programme? What are we thinking at the moment?
I think at the moment what we want to do is sit down with Annie after and go through what went well, what went not so well, what we could do to improve. So Annie's got a booklet so that she can reflect herself, but she's also got bits where people can fill that in when she's been working with them that day.
Okay.
We would only take as many on as we could support. But again, moving forward, we can take as many on that we can support.
So I do understand that Annie is wanting to do medicine, and her sort of focus was more around patients and patient care. Would there be are there any thoughts of expanding the programme to other parts of the hospice, because it's not just patient care?
This one's obviously been purely clinical, so we've made sure that Annie's spent time with everybody in clinical services. But this is something we can take back to the SLT and say, you know, this has worked really well. So
I'm sorry, SLT?
Senior leadership team.
Thank you.
So we can do one for maybe fundraising, finance, and all the other areas.
Okay. Sounds wonderful. Sounds wonderful. Annie, from your perspective as the apprentice,
Mhm.
how did you see your role contribute to patients' and families' wishes? Is there anything that, how did that sort of feel to you?
Yeah, obviously I've spoke to lots of patients and lots of families, and I've explained to them what I've been doing within the hospice, and they've all been really supportive and willing to, you know, talk to me about their experience and what they're going through at the minute. And I think it's been nice that people have been willing to talk to me about it. I found that really nice.
Did you come across anybody who didn't want to talk to you?
Surprisingly not. Yeah,
There you go,
everyone's
that's-
been
yeah.
really willing to.
Yeah. Was there anything anybody said that really resonated with you, that made you said, "Ooh, think," or
I suppose off the top of my head, my work with you, Merban, like learning about your role, when you've told me about how there's a lot of different communities that don't access the hospice, and it's why not, because everyone has these issues and should probably need to access the hospice. So that's really stuck with me.
okay,
So I've thought
which is
about
really
that.
good. Thank you. Yeah, just want to share that Annie did spend a day with me. The
Mhm.
first day didn't work out because both of
Yeah.
all my meetings got cancelled, which was not very good. But we did go to the Unity Centre in Rotherham,
Yeah.
and you handed out some certificates, didn't you? Cancer
Mhm.
awareness training certificates to the group. Fantastic, thank you so much. Jayne, are there any unique advantages that apprenticeships and apprentices like Annie bring to the hospice care, in terms of, you know, there are traditional training routes, aren't there? Yeah.
So obviously this isn't a training route. This is just Annie gaining experience so that she can apply and show that she has had voluntary experience when she applies for her medicine. But I think the thing for us is Annie doing this, we can then look at how we can do things differently in future, or how we can add it in. So Annie's programme's been really bespoke for her, as if we had some Jayne that wanted to gain experience to be a nurse, we'd change it slightly, or depending on what they wanted to do.
Okay. I'm really fascinated. I'm so excited about this program. I think it's long overdue. And I think more hospices should do this. And I'm just really glad that Rotherham Hospice was the first one, which was amazing. Thank you so much. So, अभी हम बात कर रहे थे एनी मे मॉरिस और जेन लो के साथ. एनी जो है ना हमारी रॉथरहम हॉस्पिस में हमारा पहली हायर एजुकेशन अप्रेंटिस है. अभी 12वीं किसने की है. और अप्रेंटिस का मतलब ये है कि जब आप यूनिवर्सिटी में अप्लाई करते हैं ना किसी भी कोर्स के लिए, एनी तो मेडिसिन करना चाहती है, तो जब फॉर्म फिल करते हैं तो पूछते हैं कि आपको कोई एक्सपीरियंस है, वॉलंटरी एक्सपीरियंस है. तो ज़्यादा तो लोग जो है ना उनको नहीं होती. तो रॉथरहम हॉस्पिस और जेन लो जो उनका क्लिनिकल डायरेक्टर है, उसने ये एक नई चीज़ बनाई है ताकि एनी जैसे स्टूडेंट जो 16 साल से ऊपर हैं वो उनको ऐसे वॉलंटरी एक्सपीरियंस मिल जाए. तो अभी हम शेयर कर रहे थे एनी की एक्सपीरियंस, और जैन बता रही थी कि क्यों उन लोगों ने ये नई चीज़ बनाई है, तो उसके फ़ायदे क्या हैं. So, if you've just tuned in, you are listening to Care Across Cultures with me, your host, Merban Hussain. I've been talking to Annie May and Jayne Lowe, both from Rotherham Hospice. You are listening to Link FM on 96.7 FM. If you'd like to during the programme, please call us on 0114 261 8181 or send us a WhatsApp message on 07939 849 339. So, Annie, so this was a volunteer experience programme, but you were studying as well.
Mhm. Yeah.
So, how did working with staff at the hospice and, you know, observing patients, how did that sort of, what kind of impact did it have on you?
It's in to do with.
As
my
in to
sixth
do with,
form.
with your sixth form, yeah.
Yeah. Well, it's fitting really nicely because, with Rotherham Hospice, they were really good and understanding of that. So I've been able to pick, you know, which days work best for me. So I've picked the day which I have least hours in at sixth form. So the few hours which I do have at sixth form on those days, my school's been really supportive. Because I understand how important it is to get the work experience, so I'm able to just catch up on the work which I've missed, you know, later on in the day when I get home. And yeah, it's worked really well.
So it sounds to me that this is quite sort of time intensive, isn't it? Because not only have you got being a 16, 17, how old are you now?
17.
17. So you're going through your A levels, I assume.
Mhm.
Okay. And A levels, if I can remember from my A levels, they're not easy. They're
No.
very difficult. And you're doing medicine, which is even more difficult. And then having to do, have you got any sort of social life?
Yeah. Depends on the week really, how much I've got on, but yeah, I think I do try to keep up my social life. I think it's really important. You know, on a weekend I'll try and make sure I've got at least a full day to see my friends, family, do what I want. And then it's just, I think it's about managing your time as well as possible and not sitting there, you know, scrolling on my phone.
I have to say that you are refreshingly different for a 17-year-old. You've talked about time management. You know, you've talked about having a day for yourself in a week, and you've talked about not scrolling on your phone.
Yeah, I mean, I can't say I don't, you know, sit there and scroll for hours, but I do try not to.
Okay.
Yeah.
No, thank you so much. So we are coming to a short commercial break. We've been talking to Annie May and Jayne from Rotherham Hospice, and we'll be back after this short commercial break.